Welcome back, and our first guest today is Katherine Parikh, an advanced registered nurse practitioner from the Polyclinic Lipid Clinic. Lipid management is what we're talking about. Let's talk about what is lipid.
Lipid's a fat, and you have different fats in your body, and the question is, what's the good one and what's the not so good one? And Katherine's going to talk about HDL versus LDL. You know the story. It's cholesterol, Tom.
All right. Well, I'm thinking now that I hear of liposuction, LIP, that lipid is probably some form of that general condition there. So I'm guessing that's what she's going to talk about here. Let's hear what Katherine has to talk about with Shannon O'Kelly.
Katherine, welcome. How you doing?
Good. Thank you for having me.
Absolutely. Welcome to Health Talk, and that's what we do here. We talk about health, and one of the things we're going to talk with you today, because your interest is in lipids, and you work in the lipid clinic at the Polyclinic, but I want our listeners to really appreciate your background. You're a nurse practitioner, or what we call now as an ARNP, but I want our listeners to understand your training and your area of interest and what a nurse practitioner does.
Sure. So a nurse practitioner can see, treat, diagnose, prescribe medications to patients similar to that of a physician or a physician's assistant. And so training can be through a number of ways. So, people become nurses, and then they can be a nurse for a couple of years and then decide to go back and get their nurse practitioner degree. Or they now have these accelerated programs, which is what I did. So I went straight through, became a nurse, and then immediately went through my master's training to become a nurse practitioner. And while we're doing that, we also do our clinical rotations to get the clinical experience to see, treat, diagnose patients.
So a lot of ARNP is a lot of these providers are nurses first, and then have an interest in maybe going on where you have some ability to work in the realm of like a family practitioner.
Exactly. But I have a little bit of a unique background in that I didn't come from nursing. I came from a business background and decided to do a career change and did an accelerated program and became a nurse practitioner within 3 years.
Wow, great stuff. Tell us about the lipid clinic at the Polyclinic. Lipids, I'm confused. Is it HDL, is it LDL? Which one's good, which one's bad? Help me out here.
Sure. So I would say at its core, the lipid clinic is where we help people manage cholesterol. And so LDL is the low or lousy cholesterol. That's the bad cholesterol. And H is for healthy. So that's the good cholesterol, kind of an easy way to remember that.
So HDL is the healthy cholesterol,
yes,
and LDLs in today's world are the bad. What is the difference between HDL and LDL? We all have to have a little cholesterol in our body. It's there for a reason.
Right.
So let's talk some physiology here. I haven't talked physiology since Washington State, 1982. It was a great class. Let's talk physiology.
Sure. So LDL is the cholesterol that contributes to plaque buildup in your arteries. And so that's why it's bad. It causes narrowing of the arteries and then can cause a rupture, which eventually causes blockages in your arteries. Whereas the good cholesterol, the HDL, helps with the transport of the bad cholesterol out of your system. So that's why you need to have it.
Let's talk about the byproduct of nutrition. So where does HDL and LDLs come from? It is saturated fat, polyunsaturated fat, animal fat. Let's talk about that.
Yeah, so LDL comes from saturated fat. So most common foods being, butter, red meats.
What kind of oils?
The worst oils for you are coconut oil.
Hold it. Well, hang on. Let's dispel a myth then here, because I see in the media all the time coconut oil. There's a lot of interest or a lot of recommendations use coconut oil in cooking, and you're telling me coconut oil has a lot of LDL?
It has a lot of saturated fat. So one tablespoon of coconut oil will be your day's worth of saturated fat intake.
Is it pretty common to say if it's solid at room temperature? I've heard this before. If it's solid at room temperature, it's probably saturated fat. Is that pretty common to?
I would say sure. Yeah.
Sure. Okay. All right. So if you have a diet high in saturated fat, that saturated fat comes in your body's going to break down that fat into these two components, LDL and HDL. LDL is the bad one, HDL is the good one. What do they do in the body? What does HDL do that's good? And LDL sounds like it just kind of finds its way into our arteries.
So HDL helps with the transport of LDL out of your system, whereas LDL, if you have blockages in your arteries, it's because of narrowing of your arteries from the plaque buildup. It finds its way underneath the endothelial lining and starts to create that process of plaque buildup there.
We're talking about lipid management. Katherine Parikh, an advanced registered nurse practitioner from the Polyclinic Lipid Clinic, is our guest. And Shannon O'Kelly and Katherine will continue the conversation right after this time out on KOMO.
Katherine, again, thank you for joining us, and thank you for coming down and sharing your knowledge and information regarding these lipids. LDL, not a good one. HDL, the better one. So let's say I'm a patient and I've had my blood drawn and I've been discovered to have poor cholesterol, high cholesterol. A lot of stuff out there in the market right now from drugs and different information. What am I going to experience if I show up at the Polyclinic and see you at the Lipid Clinic?
So for new patients, the visit is basically a comprehensive risk assessment. So we really go into detail about your family history, what your medical background is, what chronic conditions do you have, what are you at risk for, and then we even go into detail in regards to your daily dietary intake, your physical activity level. And then we also take into consideration, a number of other things going on. So what's your stress level? How are you sleeping? How's your oral care? And we take all of that information to kind of assess whether or not you're at risk for a cardiovascular event.
And what can you do? I mean, once you assess and identify maybe some areas that a patient needs to work on, how do you help? How do you intervene?
So we like to say that we offer tools and strategies to help patients be successful in implementing lifestyle strategies. But of course, there's always going to be the patients that need medicines and treatment in that regard. But we always like to focus on lifestyle in conjunction with that. And so we really try to partner with patients to become successful in implementing lifestyle changes in addition to possibly needing medication.
So your philosophy initially is fairly conservative. I mean, you're not going to want to medicate someone right away if you can make some lifestyle changes. And so maybe is there certain things that you recommend from lifestyle changes? Obviously, me being a physical therapist, I mean, we're big proponents of movement and exercise. You being a nurse practitioner, probably you're going to talk about nutrition and different lifestyle changes maybe from that regard.
Absolutely. So nutrition-wise, we always try to encourage vegetable intake.
There we go. I knew that was coming. Yeah. Mother knows best.
Exactly.
Always eat your peas and carrots, right?
Exactly. I like to joke that I sound like your mother when I push the vegetables.
Right, vegetables.
Especially the non-starchy vegetables. And then always encouraging physical activity, whether it's just going for walks on a daily basis or going to the gym. Any type of movement is good for you. They say sitting is the new smoking.
It is. That's right. I mean, I read something the other day that sitting is like equivalent to 2 packs of cigarettes a day if you're not getting exercise. So you got nutrition, you've got exercise. You talked about stress. How does stress affect our body from HDL, LDLs?
The exact role of stress is unclear, but if you're not sleeping well from stress, you're not well rested. You could be causing inflammation in your body if you're kind of at a high level of stress all the time, and then in turn that affects everything else in your body as well.
You often hear about this cortisol that you release when you're, fight or flight kind of a stimulus. So cortisol is not good to have in your system all the time from just healthy lifestyle. So, I mean, how often do you get all this information just from a simple blood draw?
So blood draw, we usually see through the basic lipid profile. And so we see that breakdown of LDL versus HDL.
Good stuff, Katherine. Thank you again for your time. Great job. I have a total understanding of HDL versus LDL. So thank you.